Right, welcome to the How to Get the Right Help Month. I am chatting with Maryon Stewart. Maryon, would you like to tell us a bit about what you do?
Yes, I have been specialising in women's hormone health for many, many years, and I've been helping women going through menopause, perimenopause, and menopause, and even postmenopause for 28 years. And my work came about because I started helping women with PMS a long time ago, based on the fact that we found 200 medical papers that had been published on the non-drug approach. And we ended up helping women with PMS and did studies that showed that 94% of them were symptom-free within the space of 4 months. And then in the early 90s, well, in fact, in 1990, the first medical paper was published on menopause, and it was an Australian study where they took a group of women and gave them red clover and flax seeds and soy, and they found they were able to bring about similar change in the lining of the vagina as they'd expect in someone taking HRT. And there was another study published, a Japanese study the following year in the Lancet, which is another big medical journal. And so I thought, well, I'll tweak our PMS program, turn it into a menopause program, and we can help women going through menopause. They don't have to take hormones and drugs and be stuck with all the suffering. And so that was kind of where the menopause journey began. And we also had, because we'd come to that knowing that we'd done 5 studies looking at nutrient levels, and we found that women very often had low levels of important nutrients, and that affected hormone function as well. So we knew that when women got to perimenopause that they had the double whammy. They had low levels of nutrients that was making it completely impossible for them to feel well. They're a bit like a bucket with a hole in it. And then on top of that, you've got the fact that the ovaries are no longer producing much estrogen and slowing down, and eventually come to a grinding halt, which is not great because 100 years or so ago, we weren't living much past 50, and it didn't matter. But now 40-something is pretty much halfway for most of us, and hopefully we've got lots of extra wonderful years to live, but there's no point having all that time unless you're in great shape. And the other thing to bear in mind is we're not just looking at helping people to overcome their menopause and perimenopause symptoms, but we're also looking at how do you future-proof your health? Because after menopause, when you've got no estrogen, you are much more predisposed to things like osteoporosis, the bone-thinning disease, heart disease, dementia, even obesity, and diabetes. So the research shows, I remember I was doing a book years ago called The Phyto Factor, and that was all about phytoestrogen-rich foods because I was completely knocked out by the amazing research. And when I read all the papers, I was just absolutely astounded that the research showed it really did help to prevent all of those things. So, and it also helps to prevent things like breast cancer, which is another major thing if you think about it. Certainly when I was a child, I didn't know anyone who had breast cancer, whereas most of us now do know people who've had breast cancer, and for some of us, we know lots of people and maybe even people in our family. So I remember when I was researching that particular book, I was away with a suitcase full of research materials and reading through. I found this study that was done in Israel where they had the highest incidence of breast cancer in the world, and they found that they were expecting over 10 years to see a 20% increase due to past trends, and they actually found a 34% decrease. And when they traced it back, they found that in the cow's milk, so from the cow's feed, they had all these organochlorines, which are environmental estrogens, that had found their way into people's bodies. And when people found out, there was a public outcry and they banned that, and therefore the breast cancer statistics dropped like a stone. So the great thing about knowing how to consume Mother Nature's estrogen is it fills the little receptor sites within the cells. So not only does it fool your brain into thinking you've got normal circulating estrogen again, so everything works normally, but also it prevents those environmental estrogens from getting into your cells, and so you're protecting yourself. So this is a great news story. It's great for women of all ages, and the sooner you get started, the better, because if you get started at the beginning of your perimenopause, or even before you start your perimenopause, and you learn how to meet your body's needs, you can literally sail through menopause without going down the rabbit hole. And it's much less painful. So I think, I'm a big fan. I know as human beings, we're not great at prevention. We always think, oh no, I'll do that tomorrow. And we don't really do things until we're in absolute pain. But if you can have the foresight to help yourself in advance, then you will be saving yourself a lot of trouble.
So when people work with you, do you do group programs or is it all one-to-one working?
Well, that's another story. So I had a clinic in London for many years in Harley Street and used to only see patients on a one-to-one. However, having said that, I did, when we were treating women with PMS, because we had such demand from women all over the world, we ended up setting up the first telemedicine service. So we had a telephone and postal consultation service. So we've helped women through the post, obviously before emails, and then virtually. And then I was out of the industry for a while because I was sorting out legal highs, because unfortunately my youngest daughter was given a legal high and passed away. So I was out for 6 years running that campaign. And when I came back, I made a few films. Someone showed me how to make Facebook Live films. And I made 4 films on my phone. And within 12 weeks, over 1 million women saw the films. So I was completely inundated, you can imagine. Well, I was wondering, what shall I do next? And obviously the universe said menopause and perimenopause. So from then on, I realized I couldn't just see people on a one-to-one basis and I needed to get organized. And so we tried to just help people through my Facebook group. And that got really difficult because we had so many new members joining every week and they were all asking the same questions. But they couldn't find my materials because Facebook didn't have a memory. So I was making films and I was answering questions and we were all losing the will to live. So in the end, we did a focus group and the women said, could we please have some more help? So what I did was I took my 5-month program, which was the one-to-one program that had been helping women for 25 years, very successfully. 91% of them were symptom-free within 5 months. And I took, everything we do is based on published research. So I took that and I broke it down into 6 modules and we set up this virtual 6-week course. So we've been running that for the last few years and I thought it would just teach women how to manage their menopause using those tools themselves. But actually what happened is it's really, even in 6 weeks, turning women's lives around so that they can, maybe they're not completely symptom-free, although some of them are, but they can definitely see the light at the end of the tunnel and they're feeling so much better. So we have that 6-week course that runs, which operates from your phone, but there are live sessions every week and there's a private place where people can come and meet each other and get extra support during the week, and they get course materials which are dripped out every week so they don't get too overwhelmed. And we also tailor make a program for them. So it's a personal program for them according to their taste, lifestyle, medical history, and everything you can imagine. So that really is helpful because that way they stand the best chance of getting well. And then in addition to that, we realized that women who are suffering mildly to moderately probably didn't need that degree of hands-on help. So we set up a 14-day self-help program. So that's just 14 days, 14 films, and 14 lots of information so that you can absorb all that and then devise your own program. So that's how that works. And I have got so much free content. I think I made 100 weekly wisdom films, which are probably lurking on YouTube, probably at least 100 blogs, probably more. We've got tons of free downloads, so you can check to see if you've got nutritional deficiencies, and I'm sure some of your members will want some of those downloads, and they're really useful and they're welcome to use them. So I just really believe that every single woman in the world has the right to sound information, and right now that isn't the case because there was a study done and published last year. It was a Mayo Clinic study on gynecologists and doctors, and only 7% of them said that they were adequately educated to help women going through menopause. And to me, that is just beyond horrendous. I just feel that women do so much in their lives for everybody, and there's no reason why they should be in pain at this stage in their lives. And so many women bomb out of the workplace, so many relationships are affected. We've done surveys on thousands and thousands of women in and out of the workplace, talking about all aspects of menopause, and they really do believe that menopause is the beginning of the end of life as they knew it. And that is not the case at all. You know that. And it makes me so angry. I suppose that's why I'm so passionate about helping women and just getting the word out. So our mission is to reach women all around the world in the next 5 years and to change the whole paradigm on menopause so that it becomes known that it's just a life stage and a transition, and that every woman in her 40s feels entitled to have a midlife refuel without any stigma and come out the other end of it turbocharged and ready to get on with the rest of her mature life in the most fun way you can imagine. And that's what happens. That's what we see. We see people transforming from as awful as suicidal and feeling that they've got dementia, Alzheimer's, can't string a sentence together, they can't remember things, achy, feeling 90 before their time, to having terrible headaches and panic attacks and all those awful things. You know what that's like, and dry vagina, so you can't get close to your partner. It's just awful, but it doesn't have to be that way, and the symptoms can go, which is amazing, and Mother Nature helps us enormously.
And this is what's so heartbreaking, is that so many women aren't being heard either, are they? You know, you're getting your message out, I'm getting my message out, and we and many other people in this arena, fortunately, are trying our hardest to get the help to women. But it's terrifying how many people in their late 30s and early 40s have no idea this is coming.
No, absolutely not. And we did a survey at the end of last year on 1,100 women, looking at, it was called What Women Want. And we found that 37% of them were given antidepressants for menopause and perimenopause. 84% of them didn't feel that was appropriate because they weren't depressed. And 41% were given hormone replacement therapy. 14% didn't want to take it because they were too scared. And the ones that did take it, 61% came off because of adverse side effects. And they were just left. And it is, I mean, honestly, I think I probably cry every week when I read these stories, you know, horrendous, sad, unbelievable and unnecessary suffering. It's just beyond belief. And we have to stop it. It's as simple as that. We just have to change it so that every woman in the world can feel well and be her best and contribute in the way she wants to or is needed to. Because there's so much wise women, when you get to your late 30s, early 40s, and so on, you've got so much great life experience. And if you're cowed in the corner because you're feeling so terrible, or you haven't been able to sleep so you can't think straight, you're not going to be any use to anybody.
No, and that's why I wanted to include this topic as one of our monthly topics, because often for the monthly topics I look at specific symptoms, but actually, exactly as you say, we all have a right to get the help that's right for us. And you know, the more we can highlight that people like you are offering your courses, and that there's, you know, you've written lots and lots of books about it, and as you say, you've got lots of blog posts and videos. There's so much information out there, and we just need to get it to people so that they can, you know, empower themselves. Absolutely.
And I think, and we used to go and educate doctors and practice nurses, but then the NHS ran out of budget, and it's not their fault that they're not educated. Do you know? And some people want a medical menopause, and that's fine too. And we have some people on our program who are taking HRT. Maybe they want to wean off it, or maybe they don't. But the thing is, even if you take HRT, you're never going to correct nutritional deficiencies. And we know that 50 to 80% of women have got low levels of magnesium, B vitamins, iron, zinc, essential fatty acids, calcium, vitamin D, and so on. And more recently, there's been massive studies around the world to show that billions of women have got nutritional deficiencies. So unless you correct that, you are really on the back foot. You're never going to feel well. And it's so fundamental. It's like, why would you build a house on marshland? You know, when you've had, you know, you've been through life, maybe you've had a baby or two and done some breastfeeding, or maybe you've been stressed and a dieter, or you've drunk too much alcohol, or whatever it is, you get to a point where your nutrient levels are in a low range. And as you get older, that becomes even worse. So it's almost inevitable that that's going to happen to you. And we're kind of born with this body, which is like a machine with no manual. No one teaches us how to look after ourselves. It just baffles me. You know, we learn about history and all the other things, but we don't learn about how to look after ourselves or manage our lives in, you know, in everyday lives, like cooking or relating to your partner or bringing up your kids. You know, you're just left to muddle through.
Yeah, and actually, even in terms of basic food, basic, I don't even want to say nutrition at this point, but even in terms of basic food, we get told, eat a balanced diet. But we don't ever actually get taught what that means and what nutrients need to be included, do we? It's crazy.
Well, no, I can remember doing a street survey once. It was after we'd done the first study and we found that 80% of women had low levels of magnesium. And my nurses and I took to the streets and we asked women in the streets which foods are rich in magnesium. And they looked at us as if we'd come from Mars. They hadn't got a clue. And understandably, why would they have? Because no one ever told them.
Absolutely. And, you know, when we branch that further to things like, you know, essential fats, but everyone has been made to be scared of fat, haven't they, by advertising and the diet industry. And what other people in the same sort of area of supporting women to understand what nutrients their body needs, I think is just so important.
Yeah, well, we did actually on essential fats, we did a survey years ago on 1,200 women, and we were looking at essential fats in particular. And we found that the women who had low levels of essential fats were much more likely to be tired and achy and lacking libido than those who had good levels of essential fats. And it didn't, as you said, it didn't mean that they were fat, because they are essential fats and they're good for you, and they don't necessarily make you put weight on. In fact, women lose weight on our program without dieting. And I did a whole book on that. It's just like a miracle. They don't diet at all. They eat all the foods they enjoy, but obviously the right foods that fit into the program. And some of them lose, even within the space of 6 weeks, they can lose up to 12 pounds.
Well, yeah, which once you're putting the right things into your body will respond how it wants to, right? It will respond correctly.
Yes.
And what's crazy is that shouldn't be difficult to understand. And as you say, with that, I guess it's stuff that you can hope that one day in the future people will get taught this, and it won't be unusual to nourish your body from the start rather than to hit this brick wall and then have to learn about it.
Yeah, I was hoping that would happen in the medical profession, but I just really think that's going to take quite some time. And so people that are perimenopausal at the moment and actually going through this actively do need to, and that's the other thing. There are just, Dr. Google has so much information out there, but not all information is equal. And there's such a lot of research to show that many of the supplements that are on the market don't even contain what they say on the label. And, you know, we were asked once to recommend this product that had been supposedly contained 39 milligrams of isoflavones, these naturally occurring estrogen. And I always ask for the research before we recommend anything. And they were trying to find the research for me, promising it. And I went off to a conference in America, which was on isoflavones. And I was moaning to two researchers I knew, one who was a professor and the other one was a researcher at Oxford, about how on earth was I supposed to know what was in all these supplements that had just arrived on the market. And they smiled to each other and they said, well, if you can keep a secret, we'll let you share our new paper. And they had put 40 products through independent analysis. And they were all isoflavone, supposedly isoflavone-rich products. And out of them, only 2 contained what they said on the label. And the one that they were trying to convince us contained 39 milligrams, in this independent analysis contained 1 milligram. Wow. So don't get me started. That is another, I feel so angry that women just go out there and they look at the box, it looks pretty, and they think, okay, I'll take that. But they may just be completely wasting their money. And so that's why when it comes to supplements, we really are particular, and we choose the ones that have been through properly conducted research for the given symptoms, and have also been shown not to just to be effective, but also to be safe and not cause any problems in your body, because you know you can, if you think about it. You don't want your uterus lining overgrowing. That's dangerous. You don't want to make your breast tissue more dense. That's not good either. So we need to make sure that what we're taking in is good and wholesome and is going to have the desired effect.
Absolutely. And I think certainly with the world of supplements, it's difficult, isn't it, that we can all go to the supermarket or go to a shop on the high street or whatever and just buy things thinking that that's going to do. And again, coming back to getting the right help, we actually need to be guided as to which ones we need each individually, because it's all well going, oh well, I'll just get this huge array of different things and, you know, rattle like I'm a tube of Smarties. And also, if they're not at the right level, as you say, and they've not been correctly tested, just a waste of money.
And also, some of them conflict with medication as well. So you have to be really careful if you're on medication. It's just got to be tailored for each individual. So that's why when I started our 6-week course, we didn't do a personal program for everybody. And I felt that was a disadvantage in the end. So we decided that we would. And now I feel happier. I sleep in my bed knowing that the things that people are taking are safe for them to take and it suits them and it's going to work. So that's why we do that.
Brilliant. I think we've crammed a lot of information in there. So I think I'll say thank you very much now before we confuse everybody too much.
Okay, so if anyone wants to check to see if they've got nutritional deficiencies, you're welcome to circulate our nutritional assessment tool, and
Perfect.
that's just a free download.
I'll put that with the video when we pop this onto the website.
Okay, and we have other things like on my website, there are virtual classes, and there's tons of free stuff. And if anyone is in terrible pain and wants help, then I'm always happy to make time to talk to them.
Perfect. Thank you.
Okay.